Have you ever wondered why periods even happen? Like, what is actually going on inside your body, and why does it feel like nobody ever talks about it clearly? Well, today, we're going to change that.
Okay, so let's get right into it and answer that big question. What is really happening inside your body when you get your period?
First things first, let's just lay out the basics. What even is a period?
So, menstruation, which pretty much everyone just calls a period, is a completely natural process that usually starts for girls somewhere between the ages of 10 and 15. Here's how it works. Every month, the uterus gets itself ready for a possible pregnancy by building up this thick, soft lining. Now, when a pregnancy doesn't happen, the body goes, all right, don't need this anymore, and that lining sheds. And that shedding is what comes out as period blood. And let's get one thing crystal clear, because this is so important. This is not dirty, it is not harmful, it's just your body doing its natural, healthy job. That's it.
So you might be asking, why does this happen over and over again every month? Well, the answer comes down to the body's little chemical messengers, hormones.
There are two main hormones that are basically running the whole show: estrogen and progesterone. You can think of estrogen as the builder. Its job is to build up that uterine lining. And then progesterone is the maintainer. It keeps that lining all ready to go.
So here's the trigger. When your body realizes there's no pregnancy, the levels of both of these hormones just drop. And that drop is the signal for the lining to start shedding and, you guessed it, for your period to begin. It's as simple as that.
This whole cycle usually repeats itself every 21 to 35 days. And I really want to emphasize that number because there's a huge myth that every single cycle is exactly 28 days long. For most people, it's just not. The main takeaway here is that every single person's cycle is unique. Your timing, your flow, your symptoms, it's all going to be a little different. And that is 100% okay. Okay, this brings us to a really important question. With all this variation, how do you know what's normal? And when is it maybe time to check in with a doctor? All right, so a period that lasts somewhere between 3 and 7 days, that's normal. Some mild cramps, feeling a bit tired, a few mood swings, also super common. But pain so bad that you can't even get out of bed, bleeding so heavily you're soaking a pad every single hour, or a period that just drags on for more than a week, nope, that's not something to just tough out. That's your body giving you a sign to go talk to a doctor.
So let's try to reframe this whole thing. A period isn't a problem or a weakness. It's actually a sign of health. It's a sign that your body is working just the way it's supposed to.
And because it's such a normal part of life, one of the most powerful things we can do is just break the silence around it. Talk about it. Ask all your questions. Don't let embarrassment stop you.
Seriously, if you remember just one thing from all this, let it be this. Periods are not shameful. They're not a weakness. They are simply science.
So I'll leave you with this final thought. Knowing this stuff is powerful, but it's even more powerful when you share it. So who in your life can you share this with? Who can you help understand so we can all break the silence for good?